Hello, everyone, and thank you for your interest in this presentation about women's longevity and overall health. My name is Luísa Batista. I'm a family physician by training, but I am also a doctor at TejoMed. We are Portugal's first membership-based concierge family medicine clinic, and we are revolutionizing healthcare in Portugal by allowing our doctors, such as myself, to have a list of only a couple hundred rather than a couple thousand patients, which allows us the time to really focus on getting to know our people, on answering any questions that they may have, on researching any information that's useful for them, and of course, on making presentations such as this one. And as a woman, it is especially important to have regular follow up regarding so many different hormonal questions, which makes this kind of support even more valuable. So, if this resonates with you and if you like personalized long term care, please contact us about becoming a member. Moving on to mental health. This is something that I really like talking about because it's a very hard topic to talk about. And I feel that we don't always talk about it well enough and in the best ways. So, this being a very extensive and gray area, I do not wish to talk extensively about anything in particular. I just wish to give you some clues and some ideas that might help you better understand yourself and perhaps people close to you, and help yourself and people close to you. So, the first notion that I would like you to have is that what you think is normal may not be good. So, when we say something is normal, we mean that it's common to the majority of the population that you're being compared to. We don't mean that it's a good thing or that it signifies good health. What's normal may not be good, and what's good may not be normal. Normal is a statistical concept. On the other hand, I want you to know that a lot fits in what we consider normal by statistical standards. So, the way to really know whether what you have, your symptoms, the way you are an illness or just what you are, yourself, your personality, uh, is usually to ask yourself the question: is this harming me, my functioning, my relationships consistently over time? If so, then it is probably pathological, regardless of how you compare to other people or how you think you compare, because we rarely really know. And perhaps it should be approached. If not, maybe you are just wacky, and that is perfectly fine. Another question I get asked a lot is this symptom my brain or my body? This is really more common than you might think. And it's actually an easy question to answer because your brain, as you may have noticed, is inside of your body. You may have felt it there. So you should tackle it all. There's no point in separating. So, what can you do? Well, some pointers. Sleep enough, and sleep well. Yeah, we'll go into this a bit more later on, but that's the basic. And then these other things that are as well easier to say than to do, such as eat well, exercise, socialize, and may not be so hard. Get a pet, seriously. These are all evidence based, including the pet thing. Pets increase happiness, they stabilize you, they even reduce the risk of physical illness. So consider that. So sleep is more important than most people realize. If mental health practitioners, providers had to choose one thing to improve in their patients, it would definitely be good sleep. And I think I can talk for myself and literally everyone else. And we don't just want enough sleep, we want good sleep. So the ideal amount of hours is probably 7 to 9 for most people, which in itself can be hard to accomplish because the chronotypes that we have individually, and which are all different, are not always aligned with society's norms. But we also want good sleep with good architecture. We want sleep that's divided in light sleep and then deep sleep, and we want deep sleep that has non-REM sleep and REM sleep. These two types of sleep do very different functions, both very important for both mental and physical health, and we do want both of them. So, what are some things that you can do to improve your sleep? Well, the main tip is always go to bed and get up at the same time. You want a routine. Our body loves a routine, and for sleep, it is especially important that we behave as much as our ancestors that as much as we can, because sleep biologically has not changed much. even though our society has. So we do want to approach that old stage of humanity. And then we want light during the day, so our brain knows sunlight, so our brain knows that it's daytime. And we want very little light once the sun has gone down, so our brain knows that it's nighttime. And we want to avoid blue light on electronics, not just at night, but even during the day, because it's not natural light and it makes no sense to confuse the brain with that. Then we want to be really active during the day. We want to exercise, socialize, work. This is why working in shifts, which may include night shifts, is so bad. Um, Interact, play, etc. We want to do all of that during the day, but then about 3 to 2 hours before bed, we want to stop all of these. We want to be very quiet and still. Then the usual tips that you can probably find everywhere, like no lights and no sound. So consider wearing a sleep mask and earplugs. I think most of you will have heard of this, and it is very important. And then temperature-wise, you may want to experience or experiment with warm showers. They are most effective if you have them 1.5 hours before bed, not just before bedtime. And if you then contrast that with having a cool bedroom and mattress, which really allows the body to trigger sleep initiation. And of course, that may not be enough. Even if you've maximized it, very often you are still not able to fall asleep, or you may even have other issues that are not related just with sleep. So I put together a list of some basic supplementation and types of therapy that may help with several different types of mental health optimization. So melatonin, ashwagandha, tryptophan, L-theanine, and magnesium are all good for sleep and other types of symptoms such as stress, anxiety. And the therapies here go from the most classic, such as CBT, to more experimental recent ones, such as somatic experiencing. I did not include psychedelic guided therapy here, but it also exists and is accessible and is very good for certain conditions such as trauma and PTSD. So my main point here is that therapy, in my opinion, is something that could probably optimize all of us. We should never say no to it if we have access to it. If we can afford it, we should do it, even if we feel that everything is pretty much okay. We can always know ourselves better. And even if you really need therapy and you feel that it's not going to help you because you've experienced classic talk therapy before and it did nothing for you, then I really want you to know that you have all these alternatives. You don't just have that. There's not just CBT or even DBT. There's not just psychoanalysis. You have so many things to choose from these days and so many good therapeutic people that can help you that you should really be open to the experience. And then I would like to end the presentation talking about psychotropics, which I know quite a bit about, and are another villain for many, many people. So I also want to show both sides of the coin here. And one of the sides of the coin is that definitely pharmaceuticals should always come after we've tried everything else. Like we've optimized lifestyle, we've done therapy and supplementation, and we're still not there. Or they may be necessary at an earlier stage if our current sanity is not enough to afford maximizing these other things, right? Sometimes we just can't get out of bed. And if we can't get out of bed, how are we going to exercise? So while psychotropics are not ideal in the same sense that blood pressure medication is not ideal, we should be doing other things first. They do have their place in both very serious situations or situations where we've tried other things. And the good news is that we don't have just Prozac and Haldol and lithium, which are drugs with very extensive side effect profiles and not that safe long term, right? We have so many new antidepressants and antipsychotics and mood stabilizers to choose from. And thankfully, a doctor that knows you well will definitely be able to find one that suits your preferences, the side effects that you're willing to have to cope with, and in align with your beliefs. And one note that I would like to make is that, and I make it because I get this a lot in my consultations. If you feel that you are better off taking a Xanax daily because it's just a Xanax and you're not getting on an antidepressant because you're scared of that, but you're okay with the Xanax, please do not fool yourself thinking that it's safer to take just the Xanax daily. First, because if you take a Xanax daily for a situation that should be handled with an antidepressant, such as chronic anxiety or depression, what's going to happen is that you're going to be taking one daily forever, because those are just band-aids. Benzodiazepines are band-aids. And they create dependency. You will not be able to go on without them after a while. They create tolerance, so you need increasingly higher dosages. And they ruin your cognition in the long run. There used to be a craze for prescribing this before we knew these side effects in the long run, but we now know them, so there's no good excuse for that. On the other hand, antidepressants work on anxiety and depression, and they have very well established times of treatment. They are usually taken for a few months or years, and then they are weaned off in most cases. And they are not just band-aids. They do rebalance your chemicals in a slightly more natural way. So if you are taking a Xanax daily, there is definitely better care for you. I can promise you that, no matter what you've experienced in the past, no matter what kind of medications you've been on that you hated, I'm almost positive that we could find something better for you. And of course, no matter the approach, it should always be tailor-made for you. You should be able to come to your doctor with your questions, beliefs, preferences, and anything else that could shape your decision. And you should be empowered to take your own decision based on that. And you don't need a psychiatrist to approach mental illness. You can come to a family physician, such as myself, because most of us, well, all of us are trained to do these things, to deal with psychotropics, and most of us are comfortable doing so. So definitely try that first. And that's it. You may send your questions my way. I will do my best to answer them. And I would like to once again invite you to meet me, eventually join the service if you haven't yet, because I am here, and from woman to woman, I think you deserve the best. And I hope to be able to give you the best. Thank you so much for your attention.